today the topic on focus is the hemodialysis. So we are going to compare the hemodialysis versus the peritoneal dialysis. So let's first look at the hemodialysis. So under the hemodialysis, so it is comparatively a difficult access. It is a difficult access. Next, there is a better clearance. There is a better clearance, and there is a short time for treatment. So the short time is for the treatment. So now, what is the principle of this hemodialysis? So when you are looking at the principle, under principle there is a solute. Under principle there is a solute removal. So a solute removal, and this is through a semi-permeable membrane. Through a semi-permeable membrane. A solute removal through a semi-permeable membrane. And for hemodialysis, the patient has to visit a hospital. So the person has to go to a hospital. And now, what are the complications of this hemodialysis? So hemodialysis is accompanied with some complications such as the hypotension. So the individual can present with hypotension, and there can be the disequilibrium. So there can be disequilibrium syndrome. Next, there is also can be associated with the muscle cramps and the anaphylaxis. Anaphylaxis reaction can also be present. Now we have just seen about the hemodialysis. Next we'll be looking at the peritoneal dialysis. So this is the peritoneal dialysis. So under the peritoneal dialysis, in hemodialysis it was a difficult access, whereas in case of peritoneal it is a easy access. So the access is very easy. And what about the clearance? The clearance is that it is a good clearance. There is a good clearance. So what about the time? The time is, it is a longer time may be required. So in peritoneal you have a longer time. And next, what about the principle? The principle of peritoneal dialysis. So this includes a solute removal. So there is a solute removal, and the solute removal is through a peritoneal membrane. So this is through a peritoneal. It is through a peritoneal membrane. So where can this be done? So where is this actually done? So the answer to this is that it can be done at home as well. It can be done at home. Next comes lastly the complications. The complications included are the peritonitis, then also the catheter. So the catheter associated non-peritoneal infections. So what are the other complications? It also can include the weight gain. So the individual can present with weight gain. There can be the metabolic disturbances, as well as the residual. There can be residual uremia. So this video was about the hemodialysis versus the peritoneal dialysis. We compared them, and to learn and grow daily like this, please do subscribe.